Factitious disorder. Like Jarrell, people who become physically sick usually go to a physician. Sometimes, however, the physician cannot find a medical cause for the problem and may suspect that other factors are involved. Perhaps the patient is malingering, intentionally feigning illness to achieve some external gain, such as financial compensation or deferment from military service. Alternatively, a patient may intentionally produce or feign physical symptoms from a wish to be a patient, that is, the motivation for assuming the sick role may be the role itself. Physicians would then decide that the patient is manifesting factitious disorder. Consider, for example, the symptoms of this lab technician. A 29-year-old female laboratory technician was admitted to the medical service via the emergency room because of bloody urine. The patient said that she was being treated for lupus erythematosus by a physician in a different city. She also mentioned that she had had von Willebrand's disease, a rare hereditary blood disorder, as a child. On the third day of her hospitalization, a medical student mentioned to the resident that she had seen this patient several weeks before at a different hospital in the area, where the patient had been admitted for the same problem. A search of the patient's belongings revealed a cache of anticoagulant medication. When confronted with this information, she refused to discuss the matter and hurriedly signed out of the hospital against medical advice. Factitious disorder is known popularly as Munchausen syndrome, a label derived from the exploits of Baron von Munchausen, an 18th-century cavalry officer who journeyed from tavern to tavern in Europe telling fantastical tales about his supposed military adventures. People with factitious disorder often go to extremes to create the appearance of illness. Many give themselves medications secretly. Some, like the woman just described, inject drugs to cause bleeding. Still others use laxatives to produce chronic diarrhea. High fevers are especially easy to create. In a classic study of patients with prolonged mysterious fever, more than 9% were eventually diagnosed with factitious disorder. People with factitious disorder often research their supposed ailments and are impressively knowledgeable about medicine. Many eagerly undergo painful testing or treatment, even surgery. When confronted with evidence that their symptoms are factitious, they typically deny the charges and leave the hospital. They may enter another hospital the same day. Clinical researchers have had a hard time determining the prevalence of factitious disorder, since patients with the disorder hide the true nature of their problem. Overall, the pattern appears to be more common in women than men. Men, however, may more often have severe cases. The disorder usually begins during early adulthood. Factitious disorder seems to be particularly common among people who 1. Received extensive treatment for a medical problem as children. 2. Carry a grudge against the medical profession, or 3. Have worked as a nurse, laboratory technician, or medical aide. A number have poor social support, few enduring social relationships, and little family life. The precise causes of factitious disorder are not understood, although clinical reports have pointed to factors such as depression, unsupportive parental relationships during childhood, and an extreme need for social support that is not otherwise available. Nor have clinicians been able to develop dependably effective treatments for this disorder. Psychotherapists and medical practitioners often report feelings of annoyance or anger toward people with factitious disorder, feeling that these people are, at the very least, wasting their time. Yet people with the disorder feel they have no control over the problem, and they often experience great distress. In a related pattern, factitious disorder imposed on another, known popularly as Munchausen syndrome by proxy, parents or caretakers make up or produce physical illnesses in their children, leading in some cases to repeated painful diagnostic tests, medication, and surgery. If the children are removed from their parents and placed in the care of others, their symptoms disappear.